Weight loss is a question that I get from my patients all the time, and my team came up with a bunch of questions for me to answer. So let's dive into this because I love a challenge. Why is it so hard for women to actually lose weight? The reason why it might be difficult for women to lose weight is because there are many factors. Each month we have a menstrual cycle, and depending on the hormone levels, it may be difficult to lose weight. There are additional factors that may also go into weight loss, including the intensity of the exercise, if the patient is doing cardio work or HIIT exercises, also any other endocrine issues such as thyroid issues or things that would make it more difficult to lose weight. For example, PCOS is a condition that I see often in my clinic, and I let patients know to give themselves grace because it is very difficult to lose weight with PCOS. When should medications be used for weight loss? This is a great question because right now there's this uptick of medications used for weight loss, and we have to approach this in a systematic way. What does that mean? That means we take the patient and we look at the patient holistically. And what is the reason for the weight loss? This is a conversation you should have with your primary care physician or your OBGYN to determine if medication is right for you and if you need it. So patients who have been trying to lose weight and they do the recommended amount of physical activity during the week and they're making those lifestyle changes, they've changed their diet, they're exercising, and they're not moving the needle, those may be patients that are good candidates for weight loss medication. Additionally, patients who have other conditions such as diabetes, which can increase the risk of cardiac disease, they may be good candidates for weight loss medication as well, because the data shows that weight loss can help reduce the risk of cardiac disease in those patients, as well as other issues later on in life. This next question is a good one. How do I counsel patients when they struggle with weight loss? Like I said before, if you're struggling with weight loss, that's something that's not unique to you. So I want to reassure you that if that's something that you're having a hard time with, it's important to surround yourself with people who can encourage you, who can motivate you, but also you may want to consider other things. First, you may want to discuss with a dietitian or a nutritionist to see if there are little tweaks that you can make to your diet. And I tell my patients not to eliminate anything unless there's a medical condition warranting that. The nutrition can help see objectively what foods may be causing your insulin to spike, what may be causing issues with GI motility, what could be causing issues with retaining weight in certain areas of the body. You may want to also talk to somebody who's an expert in physical activity. Maybe you might want to get a personal trainer because they can target exercises to your goals. Maybe you want to lean out, maybe you want to tone up. A personal trainer may be able to help you in that area. I know for myself, when I'm doing HIIT training, sometimes I'm doing the exercises wrong. And it's nice to have the coach who can come over and say, let's adjust this. Other things that you may consider when you go to your doctor is, doctor, can you work me up for other things that may be making it harder for me to lose weight? Can you check my thyroid? Can you see if I have other diseases? Can you check my insulin? Can you check my hemoglobin A1C to see if I'm pre-diabetic or diabetic? If I'm having irregular periods or not having any periods, doc, can you work me up for PCOS, especially if I have acne and hair growth in different areas that's excessive? These are questions that I have my patients pose to their providers, and I also walk through those step-by-step things when the patients come to my office. You know what? These are a few of the things that I go through with my patients, and I want to reassure you that this is not something to be embarrassed about. If you have issues with weight loss and you want to get started on your journey, please bring this up with your primary care physician or your OBGYN because we do want to help you. I want to keep talking about this topic. So if you want to see more content like this, if you have more questions, if you have burning questions, please leave them in the comments and I will read them and you might see it in the next video. This is Dr. Odunsi. Thank you so much for watching and I will see you in the next one. Bye.